We are in West Georgia right now, heading to central West Georgia, and it's a pretty rural place. I was actually born in LaGrange and born in the hospital where I now have the pleasure of attending births. All of this area used to be a huge mill area, so they had textile mills. And then when a lot of the jobs shipped overseas, it just kind of financially devastated this whole swath of land. All these counties are considered underserved. There are so many maternity care deserts because of a lot of the rural hospitals closing over the past 30 years. When I was serving in Upson County, there were only 2 full-time OBGYNs, and we were serving a 7-county, radius. A lot of my patients do drive long distances to get to care. It can, be anywhere from, 20 or 30 minutes on upwards to an hour or more. Unfortunately, Georgia has a long track record of having poor maternal outcomes, and also we've had poor outcomes in terms of our infant mortality rate. And this has been for decades. We have kind of been in a race to the bottom. We're either last or we're second to last. And that's been something that has really just kind of frosted my cookies. I don't like the idea of the state that I was born and raised in, a state that I really love so much, being at the bottom because I just think that we're so much better than that. Hey.
Good morning.
Good morning. How you doing?
Good. How are you?
Hey, how you doing? Good morning. All right, so I made it out here. How's everything been going?
We're going good.
Good. All right.
Ready?
So you ready? Yeah. So I don't usually make house calls, but since I was coming out here, I said, well, let me just check in on you and see how everything's going. Ashanti is a mom of mine who's getting ready to have her baby. She's done well this pregnancy, and so she is super excited to welcome her little girl. And she and her husband will be coming in soon. Baby been moving well?
Yes, ma'am.
All right. So we're getting ready for the big day coming up. So I'm gonna measure you and just listen to baby's heart rate, and then
Okay.
we can go over any questions you guys have about delivery next week.
Okay.
Oh, my goodness. We're up here right at 38 and a half, so that's perfect. Just gonna tuck this right here so I don't get gel all over your cute little
Okay.
pants. All right, Jamani, here's your big chance.
Let's sit it here in the same spot.
Yep, sit it right there. You got it.
And that's her heartbeat.
That's her heartbeat. She's reading in the 140s.
Okay.
Okay, good.
I think that having a baby is such a joyous thing, even, with all of the scary stuff that's out there. There is still so much joy and hope and resilience that I see in these women every day. Let's talk a little bit about our process. We really have to focus in on your mental health. But when I started to screen for mental health disorders in pregnancy, so moms have not done as well as they could have done, I recognized that, wow, my Black and Latina patients are screening positive more than my white patients are. And so we found that Black women, particularly, were almost twice as likely to screen positive for depression and anxiety. What questions do you guys have about the process or about where you need to be or what you need to bring or?
I don't know. I think just getting over the anxiety of having her. That's the big thing that I'm worried about.
It's normal. It is normal to have some anxiety when you're going through, because it's a big life change, right?
Yeah.
And in terms of mental health, I realized a few years ago that, wow, I'm doing really well about managing hypertension and managing postpartum hemorrhage. But it came to my attention that substance use and overdose and suicide were actually happening during pregnancy and in the first year after birth much more than postpartum hemorrhage deaths or hypertensive deaths or deaths related to heart disease. And that really shocked me. And as I started to really dig into the details, I thought, wow, what am I doing about mental health? I really need to pay attention to that because I can make all the hypertensive medication order sets in the world. But if the mom walks out of the hospital and decides that she wants to drive her car off a bridge, what have I really done?
Hey.
I definitely wanted a baby.
What's going on?
When I found out, that was the best day of my life. It was the best.
Oh, I love you so much.
And, of course, it's just, I had a combination of worry, fear, happy, joy, anxiety. When I did start feeling less of the joy when it came to being pregnant, I guess when the reality hit. With seeing everything play out on the news, I wanted to shell up. I wanted to shell up so bad. And me having a boy, that was one of my biggest concerns because I know if I had a boy, we were going to have the conversation. And in every Black household, for the most part, it's always the conversation and you know exactly what it means.
Let's see.
And I have to have this talk with him.
Yellow.
Because he's not going to understand that one day somebody is not going to like him because of how he looks. And because of that, I had a level of fear.
Gotta do our daily. So let's go read a little scripture like we're gonna do, okay?
Black moms particularly are dealing with some tremendous stress levels.
Here we go.
Not only do we have the stress of what might be happening at your job or at home,
Because he has set his love upon me.
but we also have the added stress of structural and institutionalized racism,
My God, in him will I trust. Yeah.
having to think about things like, is my partner going to make it home tonight? Or will I see them on the news, on some webcam video being harassed during a traffic stop? I'm bringing a boy into the world. Is my son going to be okay?
All right, we get you covered.
And then we pile on top of that all of the anxieties and hormonal changes of pregnancy, and it can really be overwhelming.
During the points where I was at my lowest, I would sit in a room, I would shell up, I would cry, I would just not want to talk. But when I needed help, initially I had a lot of pride because my mind was, I don't need a therapist. I'm going to pull myself up out of bootstraps and I'm going to make it happen. I'm going to do what I have to do and call it a day.
In small towns, it can be difficult to access mental health care just simply because everybody knows everybody. You can't even go to the grocery store without people knowing that you've been there. So you can imagine pulling up to the local counseling center or to a therapist's office and wondering who's passing by and seeing you get out of the car and someone saying, oh, Susie Q's at the crazy house. So stigma does matter. And I think that it is definitely something that pregnant women specifically worry about because there is always this fear in the back of their minds that people are going to say that I'm not a fit mother or that they're going to try to take my baby or they're going to say something's wrong with me and I can't parent effectively.
I can admit when it comes to being in the Black community, Black family, you definitely have a unspoken expectation of being strong. And I started learning that when I did that, I was damaging myself more than I have realized.
Having depression, anxiety, or other mental illnesses can dysregulate your hormones during pregnancy. And that can lead to all manner of poor outcomes like preterm birth, could lead to hypertensive disorders in pregnancy. And, we can also see low birth weight.
I knew at the end of the day, if I wanted to be healthy for myself and healthy for my child, then I had to take care of that. And I had to basically acknowledge the elephant in the room and then go from there. So I was not going to allow myself to be made to feel bad for going to talk to someone.
I can't believe it's already the weekend again. It seemed like last week was just yesterday, but we're back at another weekend.
We both made it, so.
Yeah, we made it through another week. So I think that the suggestion of therapy to a Black woman coming from a Black woman is a big deal because I know that when I'm suggesting that to my Black mamas, they know that I have taken into account what's going to be said at home, what's going to be said at church, what's going to be said, in their circles. And then if I follow that up with, I see a therapist weekly, they kind of look like, really? You do? And I say, yeah, I do. If I have patients that are needing help with mental health and aren't really able to access it, or if they're going through a lot of social issues, it weighs on me. Like I think about those people at night. I think about those people during the day. I want to check on them, and I'll tell my staff, call that person and see how they're doing. Like, see what's going on with them. Are they okay? And I think that, those are the things that that it can be a little bit more of a weight that I don't think people realize.
It's like, what? You're not Superwoman?
No.
You don't have a cape?
Now, I do have a couple of capes, but I'm not a Superwoman. I mean, I'm a regular person. And so I really, when it comes to, like you said, that cultural aspect, I sometimes do feel that extra weight, that extra pressure of, I have to speak up for this patient that looks like me.
If another doctor suggested that I go see a therapist, I probably would not have gone.
You got a lot out of this therapy.
I did.
You said put my pride aside. Like, what do you think was stopping you in the past from going the therapy route?
I mean, for the most part, especially culturally, it's taboo in a sense, The difference with Dr. Joy was the fact that I haven't really had a Black doctor. So used to everything was perfectly fine.
Yeah, I think a lot of people get worried that it's not gonna work out, but
she just made me feel so much more comfortable. It does.
People, like, I think
Had I not gotten a therapy, I cannot say I would probably be able to even sit here and talk to you. I probably would not be able to have this conversation. I would probably have a complete breakdown.
Hey, my man. Hey. Hey, daddy man. Hey, my big strong man. What's going on? You're gonna be a great man one day.
Babies are always beautiful when they're little.
Oh, let me get that when you take it off my neck.
And when we go out, people all the time, they're like, oh my gosh, she is just so gorgeous. She's so beautiful.
People, let me tell you about my best friend. Yeah.
But I look at him and I know he's going to grow up.
You're almost my height.
It still weighs heavily, but it's not as heavy as during my pregnancy.
He's a warm-hearted person that'll love me to the end.
I feel like if I didn't have the therapy, I would probably have gotten stuck somewhere at some point. So, you know, when you have somebody else there that can help you and talk to you and give you a different perspective around your own mind, you know, you can't see yourself from the outside in. And having that is a big help. All right, let's get you changed, Munchkin. When I hold that little boy, oh my gosh, the level of joy that he brings me is amazing. I may be down one day, I could pick him up and I will forget about maybe what I was upset about.
Where are you off to? In such a rush.
I feel like I just have so much more meaning to life. I feel like I have a reason to keep going, to keep pushing, to keep fighting, no matter what it is.
All right, little one. Let's get you.
It's a story of resilience. It's the rose that grew in concrete. It really just kind of lets you know that at the end of the day, we have an opportunity every day to make something wonderful happen. And it just fuels my desire to do better every day, to make the system better every day. Because I believe these moms deserve it.